This is Average Joe PT, and today we're going to look at Mr. Spiny again, and we're going to talk specifically about sciatica, where it's possibly coming from, and what treatments that you can do at home to help Mr. Sciatica symptoms, as well as look at some of these muscles that I'm pointing in here at you, boom, that also can go into spasm when you're also having some sciatica symptoms. So stay tuned. Average Joe PT, here we go. All right, let's get a little bit more specific on the actual anatomy and where your symptoms might be coming from with that sciatica. And so the blue band here is going to represent the sciatic nerve, and it comes out from these on either side, the sciatic notch in your pelvis. But you can have your symptoms irritating from much, much higher in your spine. So if I come up nice and close, you can see that these green little nerves are called peripheral nerves. They come down from the spinal cord, and as the spinal cord ends at about L2, they come into those nerves, and anywhere along that track, you can get that nerve irritated, whether it's from, people always talk about the disc. A lot of times it's just inflammation, or you could get it from what we call the facet joint. You have one on each side that kind of glides on one another, and they can get arthritic and get inflamed, and that can cause you some symptoms into the nerve and down into your legs. It could be some referred pain from the joint or from the muscle group, those muscles that I showed you earlier. They can give you some symptoms that go down into your hips. But if you're having any symptoms that pass that knee, it's probably good old-fashioned sciatica symptoms. So those are some specific areas that you can get symptoms going down into your legs, whether it's coming from the disc or whether it's coming from the joint here is on the sides. You have them on both sides, those facet joints. Or, as I've talked to in the past, and you guys can, I'm going to leave a link up in the corner where I discussed piriformis syndrome, and where the piriformis, as it comes out, now I'm just going to show you as a pen representing the muscle group, that piriformis. It can go above, it can go below on some people. We're not cookie cutters, that muscle group, or heaven forbid, it splits the nerve, and you have that piriformis splitting that nerve, and that nerve coming out between some muscle fibers. And so you could have good old-fashioned piriformis syndrome that's coming from this area, and it's kind of squeezing that sciatica nerve. So that's another possibility of your sciatica symptoms. So there's some multiple spots where you could get sciatica symptoms, as well as if you fractured one of the vertebral bodies from an accident, or one of the pedicles that we talk. These are called pedicles on the sides, or the spinous processes, that one in the center here. Any of those get fractured, causes inflammation, irritates the nerves, or heaven forbid pinches the nerve. That can give you sciatica symptoms. So let's talk about some treatments that you can do to hopefully help reduce some of your sciatica symptoms. Stay tuned. Let's talk about treatment number 1. I've talked about this till I was blue in the face, but I love talking about it, and I'm going to talk about it some more. Anytime you're having nerve or sciatica symptoms, the last thing you should be doing is sitting in a chair or recliner chair or soft sofa that makes your spine do this, that letter C. You don't want to be the letter C. You want to be sitting up. You don't want to be sitting on your tailbone, your sacrum area. You want to be sitting on your butt bones, or what we call your ischial tuberosities. And so that you're going to take your magic towel and basically block it at that tailbone area so you're sitting upright versus rocking down on it. So you want to block that area, or sit back in a chair nice and tall so that you're not rounding out that lower back and elongating all those muscles that are going to irritate it, as well as irritate the joints that we talked about earlier, those facet joints. When you're kind of opening them up, after a while they get irritated and get inflamed. So that's treatment number 1. Posture, sitting appropriate in the chair. Treatment number 2. When you're having nerve symptoms like sciatica, Ice it. Ice reduces inflammation, slows down the nerve pulses. That's what you want to do. You don't want to heat it up. That's going to speed up the nerve. If you're just having some back pain, some back muscle problems, that's a whole other story. You can kind of go between ice or heat. But in this discussion with sciatica symptoms, we definitely want to use only ice. Just don't burn yourself. Like I always say, 15, 20 minutes. Take it off an hour, reapply until your symptoms reduce. Exercise number 3, or treatment number 3, however you want to look at it. In your bed, I want you lying on your stomach. Maybe a pillow underneath your belly initially. Give you a nice little lateral view here. It's going to take you out of that sitting or flex position that you maybe have to work in or do all day. Get you on your stomach so that you can at least get the spine straightened out, reduce the stress on those joints, and at least put these muscles that are part of your spine in a nice shortened straight position versus them being overstretched or elongated. You might even take a pillow, put that pillow underneath your belly button, and then throw some ice on your lower back. That'll help your symptoms. Maybe lie like this 15, 20 minutes, 3 or 4 times a day until your joint and the nerve symptoms start to reduce. That's probably one of the best techniques that someone can give you out there. On your stomach, in the bed, because you're probably going to be hurting too much to get on the floor. So do this in the bed with a pillow at your belly button, and then go ahead and ice it for that period of time. So that's a nice treatment number 3. Treatment number 4. I'm going to give you 4 today. 4 big ones like last time. Now this is the extreme. You're going to take a towel. You could take one of your sheets, and essentially when people are having a lot of sciatica symptoms, one of the best things to do is lie on your side. People will tend to lie on their side because it takes all the weight off of the spine, and as you can see, it puts you on your pelvis or your hips. But that being said, when you're on your side, your body's still going to kind of cave down. So what people tend to do, this might help you, is just take a towel and kind of roll it up, kind of twist it, and so that what you do is you wrap the towel around your hips. And so wrapping the towel around your hips will gap between your bed and your hips, so that when you drop down, you don't drop down all the way down to the ground or to the surface of the bed. So wrapping a towel around your hips sometimes can fill the gap when you're lying on your side between your spine and your pelvis. So that's your 4th treatment for sciatica symptoms. So those are 4 nice, easy ones you can do at home to help reduce your symptoms. Subscribe down below. Bring some friends. Like I always say, I'm going to keep bringing that content. I want to thank you, all my subscribers, for showing up. Leave some comments down below what you want me to talk about next, I should say, excuse me. And until next time, look up and keep smiling.